assistant here on the same doorstep, so you're not having to search for it, because I think a lot of patients don't necessarily see where to go or know where to find access for these sorts of treatments, but also they don't necessarily know how it's going to benefit them. And actually, if again it's there on their doorstep and others are using it, they're not having to seek.
And there's it provides a huge amount of stuff. I mean, Morgan can tell you about what they do on a day-to-day basis. So
and that's the thing, is it's not one
or
the other. It's the idea of it being a difference alongside benefits it. For the household, it really helps not only through treatment but also the recovery phase, which often is that lifeline you need post-treatment. Where you're not receiving continuous care from the medical team.
Well, and it bridges that gap between getting back to some kind of normality, whatever that looks like for the individual, but also that very constant appointments and clinics and consultations. Some people do find that gap makes them feel quite vulnerable. So we definitely do a lot of work here around that phase of the process.
Fantastic.
And often what we find we have an array of wonderful services in here. We've done loads of groups of workshops here, but I think what's really key as well is that we're a hub, and because we know the clinics, a lot of our patients still find this. Everybody just really diagnosed and it's quite open, it's all very clear. So we understand that but we'll work with the to see really dark what you truly need and we've got use exercise and we'll work out it's
the family practitioners, there are very few appointments, so we feel incredibly lucky to have that we just support families. And I think it's the combination of all of that probably is fairly more and more examples and more cancer centres are looking at
treatment and recovery in an injunctive.
It's looking at the talk to somebody. Just messages and share that experience. It's so powerful.
Great. Well done.
Hello, Lily. I'm our centre manager.
And some of our, Shirley is one of our team members. Hello, Kerry May.
Lovely to meet you.
Nice, Martin.
Very nice to meet you. I'm Jackie. Hello. Very nice to meet you. Some of the people that are currently using the services and indeed volunteer as well.
Yes, okay. So who's currently using the space there? Yes. And how did you hear about it? Because I was just saying some patients don't know necessarily that.
My husband had bladder cancer and was diagnosed in October, and they said to come over. We literally did come over. Unfortunately, his journey was very short, so he passed away in March. Very, very recently. For him, the support here, the counselling, the workshops, the exercises and everything, the bond therapy, and cancer as well in the past, but to get over and through the grief, coming here has been essential. It's been an amazing place.
You're still using the support system and the relationships you've built here.
Yeah, amazing. Yeah, they're all angels, incredible.
They
are.
And I was going to ask actually earlier, because it's not just supporting patients and through their treatment, it's the family.
And you don't know what to expect, you don't know about the advice and what to do and what journey to go on, so they've been absolutely pivotal in helping me through that whole journey.
And how important has the holistic approach been to both you and
very, it's really important to Graham. It's been very important to me as well. So I'm now doing some of the classes and I've got reflexology this afternoon. It's been very important.
But it's really, I think it's so fantastic that actually medicine now, but also cancer care and treatment and healing is also taking this sort of more holistic approach, looking at the whole body and the whole person in mind, body and spirit. Absolutely. Because we know now through so sort of much science and research that actually all those three dimensions matter to someone's recovery journey, but also their journey even post-treatment and even after cellular loss and stuff as well.
It's an amazing place.
Do you think there should probably be more places like this? I was wondering whether this is sort of unusual and unique in many ways, of having it so close also to the hospital set up right on the doorstep, so it's easy access for patients and families.
Well, when the brain was in hospital and had some dark days, I'd be able to come over here, just have a cup of coffee, have a good cry, have a chat. That made a big difference to be able to get back and be able to deal with the next bit.
And how many of the volunteers who are here have been through the experience of either losing a loved one or gone through the experience?
So I started as volunteer here. I'm now on the staff, but I started as volunteer and I had cancer myself. So I'm really out of my treatment, and this centre wasn't here then. So I can see now with the support that I'm able to, give the patients and all the things that are in place to help that weren't here when I went through it. So I see the difference that it makes, and it's just phenomenal.
And where did you receive this type of support? If this wasn't, didn't know?
No, I didn't. So it was just family and friends, and and I can just see the difference that it makes. Just having this here and knowing, people come in all kinds of states. Some of them are really emotional, having just been diagnosed. Some are a bit shell-shocked, and we're able to sort of talk them through and walk them through the whole thing with them. So, and it just makes such a difference. It really does.
And what seems to be really fantastic is that there's a real personal approach, because actually what's going to work for one person is a massive therapy or acupuncture might work for somebody, but actually others might be looking just for sort of that peer support and to talk to somebody.
They do, and some people just want a quiet space, and I think the beauty of this centre being where it is we're close to the hospital, but we're not within the hospital, so it doesn't feel clinical when they come here. It feels really relaxed and just a lovely space to be in. So quite often I just come in and just get some quiet time. We'll make them a drink and leave them together.
And do you get much feedback from the clinical team on the advantages of having a support system like this?
I think everybody really recognises how important it is.
So having gone through it myself, you know how important it is, but sadly some people just don't have access, and also they don't necessarily. Yourself, everybody expects you, right? You're finished, you're done, you're better, go.
And it's not frozen on the allotment.
I was fed up with people. So Shirley suggested that I join choir, even though I can't sing. But I have done, and so every Monday
I bet you can sing.
come here every Monday and make use of the services, but that fellowship with people at different stages of diagnosis, recovery, but nobody puts their head on this and they know where you are.
And it's life-changing. For anyone through, whether from the first diagnosis or since post-treatment and things like that, this is a life-changing experience for both the individual patient and also the families as well. And actually, sometimes goes sort of unrecognised. I think you don't necessarily, particularly if it's the first time, you don't appreciate how much impact it is going to have. You actually have to find and that takes time. Someone described it as sort of healing recovery journey to me as something like a and it's a road which is not one smooth thing, which you expect it to be, but the reality is it's not. You go through hospitals, and to have a place like this, to have the support network, whether it's through creativity and singing or gardening or whatever it might be, is so valuable. So it's great that this community has it. it would be great that lots of communities have this. I will do. No, not at all. Honestly, but he loved his time. He misses it. He misses the camaraderie of being with the team and everything there and flying. And, but no, he's got non-have respect for the team and what they do.
He's finished his air ambulance career now. He's incredibly grumpy and miserable at home.
What's his name?
Dave said.
Okay, I'll mention it to him.
But I did do an incredibly impertinent request back in February.
And how's things going with you?
At least we can do. But no, yeah, and that's the thing is for him as well, finding the next phase for him, the next journey for him.
Oh, I've got
Yeah.
we've made him join the choir for support. He won't be lost.
That's the thing is
Problems clearly being has introduced people to lots of different creative activities that really support people to be mindful and just stay outside of house.
And it opens up the conversation, doesn't it?
It does, it does.
Sorry, I'm away.
playing, is one part, one of the sort of core pillars of building any loving communities, and actually being able to do that in lots of different ways here. It's such a wonderful example of what good looks like. So, very nice to meet all of you. Thank you. Thanks for the hard work, and I'm really glad.
Thank you. Bring your tea.
Do you need a refresh? Hello.
Hi.
Very nice to meet you.
Pleasure, my name's Ben.
Nice to meet you. Hi, I'm Carol. Hello.
Hi, Victoria. Nice to meet you. Nice to meet you,
I'll find a cup of tea. Very nice to meet all of you. And are you currently receiving support here from the hub? And how are you finding it? Is it a good space for you?
It's amazing.
You found it valuable?
It's really amazing. It's my happy place to come. Yeah. So I was diagnosed in 2010. So and I found this place about 18 months ago, and like I say, it's literally the best thing that's happened since my diagnosis. It's really helped a lot.
It's so good to hear. And what is it particularly? Is it meeting people? Is it the treatment you're receiving here?
It's a combination of everything. So the therapies that I received here, I've never tried them before, so it was all brand new. Everything helped the people. Spend so much time in hospitals and wards and being scans and stuff like that. Come in here. Completely baubles at Christmas, just on the off chance, and just talking, and it's enabled me to be able to express myself a little bit more, because the first 13 years I wouldn't really talk about it, not even with my oncology team. Jokes, and she says, "Oh, you're going to your happy place when I come to here."
But in lots of places, when people are going through such a tough time in their lives because of the diagnosis and the treatments, and as you're saying, the scanning and everything like that, actually to have a place like this that is for them, that is personalised in a way that patients do feel that this is special for them, and you're seen as a person rather than just a patient going through another set of treatments, because that's the normal path in terms of medical route. I think it can be transformative in someone's recovery journey, and also through supporting them through what is really difficult. How much you have missed a space like this, because I think science tells us that sort of it's important to consider ourselves as sort of mind, body, spirit, but actually if you're not exposed to it, if you haven't necessarily even tried it, a lot of us go along thinking, how is this going to actually help me?
Absolutely, yeah, absolutely, yeah.
But did you realise how much a place like this was almost missing?
So I didn't ever know it was available.
Yeah.
So now being part of it, I think, why have I not had this for the entire time? I don't even know if it was available, but my wife found me this when I was having a real rough time. She got me involved, and I've never looked back. It's just been very important to me.
Yeah. It's really, really great. I'm so glad a space like this is here, the likes of yourselves and for so many other families, and not just the patient, for just hearing earlier as well from extended family members, the loved ones, because I think it's a really tough journey for them in a different way.
Absolutely.
But it's great that the support is there for them as well. And from a volunteer's perspective, how long have you worked here?
So I've volunteered at the Trust since 2016, mostly in cancer services. But was very keen when this space was going to be opened to be involved in it, because I've been a cancer patient myself, so very aware of it doesn't just affect us physically, and it has, like you say, that ripple effect. I feel that I'm able to give back, I love volunteering here. It fills my soul.
Yes, absolutely.
I love it.
But it must make such a difference for those coming in, particularly for the first time diagnosis and things like that. And really, it's a very scary journey, and to see those and the volunteers who are here, who've been through a similar journey, but to feel that sense of hope and positivity.
Yeah,
I think is a really, it's such a positive way to consider, what is otherwise a very scary and daunting time.
I think it helps.
Lovely. Every single time I've walked through that front door, it's always been positive, changes the mood. And the amount of other times I've been in the hospital, I'll walk out the big door and I'll be like,
Breathe slowly. It's also easier for you guys.
No, yeah, pleasure.
Yeah, really good. I was just asking how long this has been
Remember the height? Yeah. So to do this, so it's kind of on a didn't break. Huh?
You're very it now.
Huh? Done.
Yes.
Look at this, I've even turned it over for you so you don't get wet.
Oh, thank you. You've done all the hard work. Thank you very much. You can have it.
I do it, mate. You know, I know I wrote to him before I was, but I apologise for
Am I allowed to
leaving
not
you.
wear gloves?
I'm not wearing gloves. No, I'm not wearing gloves.
Like
but
feeling
the
the earth.
yeah, the feeling the earth. So basically, with Doug and whatever, I think all it is when we're. So he said, depth-wise, they literally can go in at top depth.
Yeah.
So if I.
Is this the right depth? I don't need to dig any more.
I think you should be alright.
Okay.
So I can check. I'll check that one. No. It's good. You can check it in the pot if you want stuff.
So you turn it over.
Also, I get the chance now to say, I'll do it in a minute when we're not being. There we go. You're there.
About
you're
the
there.
right.
You're about the, yeah, I think just actually it can come up there, come up a little bit. You lift it and then I'll push. There you go. Try that. There you go.
Because when I planted those before, you know when you've got the bit of the root.
Yeah, so you've got the graft. So there's a whole conversation goes on about whether the graft goes too deep. So in a sense, is that if you're on wetter soil, keep it slightly higher.
Yes.
If you're on dry soil, keep it slightly deeper. But because yours is a cutting, it's got no graft.
Okay.
So that means that actually it can go in at level and you don't have to worry about it.
Okay. And then backfill it?
Yeah, and then just literally backfill as we work around, just making sure there's no. You know what you're doing, I need to tell you that.
I don't know.
You do exactly what you're doing. Just make sure there's no air gaps, really. Are you good?
I'm good, thank you. Yeah.
Good.
Being able to do this sort of thing, though, I think has been really beneficial, not just for me, but also for my family. To be able to get in the garden and be busy outside. This has been a well dug hole. So how many roses have we got? How many roses have we got here? Then?
And then there's some gone to ring.
Yes.
So they're there as well. Yeah. And then all the others that we've got ring. Yeah, if I can do one thing, I can dig a hole.
And were you busy, Adam, at Chelsea this year?
At Chelsea, and then to be fair, I was in Hampton Court. So I was filming in 30 degrees.
Then how much do you press it down?
Just literally, just work it in very slightly.
Yeah.
Work it in. That's it. That's great. And that was just all water in. That's fine.
Okay, there we go. And if these, will they come back if you regularly deadhead them?
Yeah, so they'll keep flowering. Yeah.
Have I got another one to do?
You can do another one if you want, or do you want to go and talk to the other people? Do you want to come and finish this one?
Hello.
Hello.
Very nice. My hand's now.
I'm a gardener.
So it doesn't matter.
Pleasure to meet you.
Very nice to meet you too. And are you volunteering?
No, I work for the NHS for 8 years.
Yes.
So I'm one of the founders of this project.
Yeah.
So the RHS were looking for somewhere in Essex. And I very quickly stood up and said, yeah, well, come here please, come here.
We were just saying to actually to have this environment here for patients who are going through the clinical treatment, but then through to the Wellbeing hub. Yeah. To have this space for them, I think it's just so valuable.
Yeah, it's a real therapeutic sense of flowers sometimes. It's very.
You know, weeks like you were in there, we did a conversation. We were sat in a room at the back, 18 months ago.
Yeah.
And I just said, can you believe we were sat there discussing this? Nothing's going to come out. And I'm already going, no, if this is not going to happen.
But this is what community spirit's about. Being able to sort of work in partnership, come together for the good of in this case the patients here and the community here. I think it's really fantastic, visionary, and also the team that is involved to help make it happen is really fantastic. So well done.
The people that are their lowest, they're here for healthcare reasons or whatever, and to have somewhere that they can totally.
Some of the patients that come through here never garden. Come through, see everyone working, and it's like try and get a hold of them. So that's really inspiring for them. So well done. Lovely to meet you. Thank you.
I'm old school.
smells like it does. You can cut it back. Yes. It's through a blender. Like all those good things. Yes, so I did this.
White trainers in soil, not having any sort of code.
And see it, yeah, I think so exciting. And how long would it plant like this last for? How are you? I guess I'm looking after tendon ticks.
The soil makes a difference, position makes a difference, very powerful, between 10 and 40 years. You could, I don't know. No, I know you don't.
No, that means someone's playing them.
But the gardener removed.
Yeah, exactly. You can make your garden bigger. Thank you. Well done. Yeah, thank you for being part of this and looking to it. Special relationship with me as well. You're far more than I
Sorry, wouldn't mind just taking a step forward?
Oh, sorry.
Thank you so much. Not at all. No, not at all.
Are you glad for the rain? I know it's annoying today, but it's needed from the garden.
Perfect planting condition. Perfect.
And we've got John in the background. So John is an SNF volunteer garden daughter that you're going to and she going to know some youngsters coming through. And that's the thing, it's not, I know
Yes, he is.
Thank you.
Yeah.
Nice to meet you. Yeah, do you work here? Yes.
We
Nothing. Not necessarily on a rainy day today, but like yesterday, I imagine it was fantastic. It's really great. Thank you for coming to say hi. Thank you for coming to see us. Sorry I brought the rain with me. The garden weed.
Physiologist.
Is there anyone left in the hospital?
I was actually just wondering about
Will you say hi to everyone? I'm sorry, there's everyone waiting and being in the rain and everything. But I just want to come and say, doing a good job. Say hello. Hi. Who's this? Who's this? What's her name?
Just Dolly.
Dolly. Those look yummy too. Those parsnip crisps. They look very delicious. Hello. Hello. Yeah, very nice to meet you.
Hello. Our best wishes for you.
Hello.
Thank you. Best wishes for you.
Thank you very much. Nice to meet you. Hello. And are you local to the area? Are you working here? We're from Colchester.
Yeah, we're just visiting a family member in hospital.
Yes, okay. I was just saying it's really lovely for family members here too, also to have the space. I was just saying to be able to have sort of go to the clinical support team, but actually to have the wellbeing and holistic support here.
Yeah.
In the hub and in the garden setting, I think it's really special for families. Yeah, it's needed as much for the patients as it is for the families. So
That's fine.
yeah, and it must be nice for you as sort of.
I'm one of the chemotherapy nurses, so we look in really well.
Well, I'm just saying, really well done, because it's not easy to actually have that sort of really linked-in partnership.
No, it's really, the patients love it. So.
You must really see the benefits for them.
It's nice, especially if they're there for a long day. Gong therapy.
I know, but they were all saying that there were so many things, treatments that they hadn't necessarily tried. They didn't know that how beneficial they were going to be for them. But also to have a space where all of these was just in some place that they could just go.
It's not clinical, it's
exactly.
But you're in good company.
Yeah, it's a really fantastic model for other hospitals to look at as what good looks like. So yeah, it's really inspiring to be here. So thank you very much. Nice to meet you. Hello, hi. Nice to meet you. Hello. Hello, lovely to meet you. You too. What are you doing? Are you part of your training?
Yeah, so I'm studying to be a children's nurse. Okay. So at the minute I'm on the children's ward and I do like a placement. And then so I switch between placement and uni.
And is the children's ward here on the site?
Yes.
And how come you specifically wanted to go into that?
Well, my mum went to and she absolutely loved it. So I thought I was going to have
It's very inspiring to do, but it's really obviously very much needed. But it takes special type of nurse. So no, we're really well done. And also to have a lifeline like this here, and I don't know how connected into the oncology unit you are, but have this sort of environment actually for patients, staff members and families. Lovely to meet you. Good luck with your training. Nice to meet you. Hello. Hello. Very nice to meet you. What's your name? Linda. Hi Linda. And you?
You're the living proof that if you don't give up, you get the place. Girls, the three of us, now we speak together. Oh, did you? You'll have to give me your number and I'll if I get this. Let's come for an interview. Stethoscope and everything.
then I was like rushing all the water. It's just like, wow, that's so cool. Where is this? These are some fun now. And they were like, oh. I want to see my face.
And you visited her? You took a photo of me. Yeah, thank you for taking a picture. She's going to take a photo. Yeah. Thank you. I'm just going to take a picture. I know. Very nice to meet you. Just be like, we can take a group photo. Emily, this is I've seen sort of lots of different members of the team. It's really, it's lovely. No, it's fantastic. And great to have this space here, I think, for both staff, patients, and families alike.
Picture with the
Yes. If someone's booth, then we can maybe. Neil, Tom, would you mind taking a group photo, please?
I'll do it on one, and there we go. I'll do it. Yeah. Great. 1, 2, 3. Perfect. Oh, that's me. 1, 2, 3. Perfect, guys. Thank you so much.
Lots of different parts.
Yeah.
emergency
Gosh, well done. I just say it's so, fantastic. Wellbeing space. It's really must make a big difference.
Yeah.
Patients and families and staff as well. So it takes us a different dimension in terms of looking at healthcare for patients.
Yeah, definitely.
Is it part of your training now, looking at sort of that holistic model? I don't know if it's part of it.
Definitely a lot more. I think at university they definitely try to make team people to do this.
Yeah, I can see that.
We all know each other, we all just do the same rotations basically, so
it's a really great model to look at for other hospitals and really inspiring. So yeah, nice to meet you. Get Everyone's cut. I'm sorry to keep everyone waiting. Thank you very much.
Rota, so we move down to the end of the path there.
I shall talk to these gardeners now.
See you later, yeah. Yeah. Perfect conditions for planting. So, no, it's been really enjoyable. So thank you very much. Thank you so much. I think that's on my back to those problems. Yeah, it's really positive. Very nice to meet you. Thank you. Goodbye. Lovely, yeah. Very nice. No, it's really, honestly, it's really inspiring to see what's going on. Great.